All right, our next panelist is Mary Naccarato, who has had firsthand experience, as many of us have, as a family caregiver, which has been translated into a deep understanding of the challenges that employee caregivers trying to work a full-time job and being a caregiver and what they face on a daily basis. Mary.
Good morning. I thank you all for coming. I know, talking to some that I work with here at Boise State, getting here today was a challenge, as Danelle mentioned, just trying to organize. My role at Boise State University is in Human Resource Services. I'm a benefits administrator, and one of my jobs is to help folks with the Family and Medical Leave Act to understand that they do have the right to take time away from work to balance their life and their caregiving responsibilities. Some of you folks here have already gone through your employment stages and may be retired, but you may have children that could possibly be taking some time off work to come and be with you and spare you some of the caregiving responsibilities. The federal law, the Family Medical Leave Act, was created for balancing. Not all employers are required to do FMLA, but if you work for a government agency, a school district, or if your employer has 50 or more employees within a 75-mile radius, then FMLA is required. That's how I meet most of our caregivers, is because now they're needing to take this time off work. It may be full-time, may be intermittent, it may be working a reduced schedule, but my heart goes to them because I have been a caregiver, and I really didn't take advantage of FMLA as much as I probably should have, so I tried working full-time. My father was in Emmett. I was going back and forth, and as I hear stories, I think, I'm saying take care of yourself, and I didn't myself, but I can see the after effects of what it means to give up on the physical activity or not take time for yourself. The other part too, it's hard, is when you are employed, you have a manager that needs you to be doing your work. And our security, our benefits, all those things are so important to help you be stable with all these other events going on. So we're Friends in Action, Doneen and Stephanie, and a group on campus is really addressing how do employers and employees work together to manage this evolving and increasing demand of folks to be caregivers. And so we're excited. We don't know what it's going to look like when it's totally done, but we are trying to help both directions because managers aren't trained to understand FMLA either. So if you're an employee trying to do both, also understand that the managers be in communication with them. You don't have to share your family's medical information, but you should be helping them understand, you know, I may need to take occasional time, I may need to be out for periods of time, and that's what we want to help employees balance and get a good work relationship so that's not another stress in their already stressful situation. But I so appreciate you being here. And my role now, my father's passed away, but I care for our caregivers. We have a conversation with caregivers group that meets once a month. Becomes who can attend, and it's unfortunate that people can't even get away to work to come to that. We're so busy. But those that do, we try and help one another, not pioneer our way through every single stage. Some have also ended caregiving, and they come and share what worked for them, and just reach out. This is such a wonderful opportunity, one-stop shop to get what meets your needs, because as everyone cared out or shared what they're caring for, it may not all be the same needs, but there's resources that can certainly help. So thank you for being here. I love you all.
We love you right back, Mary. We love you right back. So here's your question. And this was from someone who said, I'm just getting started with caregiving and I work full time. So, you know, that beginning. How many of you were fully prepared, ready to go, and knew everything before you started? Raise your hand. Yeah, that's what I thought. So it's a good question, isn't it? So I'm just getting started with caregiving, and I work full time. I can't afford to quit my job. who could, right? So what will I be facing, and what should I plan for?
Well,
Big
again,
question.
if you have a human resource services department with your employer, contact them. A lot of times we're learning of folks taking this leave after having maybe an absence issue and a performance issue, because your job does take a bit of a toll. You cannot be everything. You cannot do everything. So something gives. Don't wait till it becomes a problem. Don't do those, hide it for 18 years and say, I'm Superman, or Superwoman, and I can do it all. Talk to your HR folks. That's what we're here for, is for our employees are our assets. Our Boise State University is great with our students, but we don't survive without healthy and productive employees, and we want to help them to be able to balance both. And this isn't a permanent job assignment you have as a caregiver, so you want to protect what you need in the future. We want you to not forego promotions because you're in a caregiver role. We don't want you to quit your job because you can't see that there's any way to balance. So that's my first, is to talk with them, because we've helped a number of people, and I've got resources. I send them to Friends in Action website because I know that Stephanie and all of her group has done a tremendous job to consolidate information. Send them to the National Alliance for Caregivers site. You know, you may be at home with your family member, but if you can get access to internet, get online and start searching, and you'll be surprised how much is out there that's answering the questions you're trying to get answered. So thank you.
Thank you, Mary. Thank you.